You know, I'm here with Dr. Burns, and I just heard his beautiful testimonial. And first, Dr. Burns, I want to say thank you.
You're welcome.
And people that have been to Dallas that know me know that everything is about being the best in what you do, putting passion, perseverance, and being prepared, as Dr. Burns said, for the future of healthcare and the future of chiropractic. One of the things, Dr. Burns, you mentioned is that you've been to a lot of other groups. Now, what I say in my seminars, the other groups are more like an HMO of consulting. They put everybody in a room and they just throw it at you. But this, we try to customize it. Tell us about, what do you think about this versus the other groups that you were with?
Yeah, over the years, you're pretty well think you're blessed if someone will make a visit to get a little bit of information about you so that they can customize it. As I said, mine was such a unique background, having medical clinics and essentially being a manager for that now. They collected that information. It's one-on-one. I have both the doctors, Dr. Bard and Dr. Kaplan, in the office with me this whole time. And we've come up with some very customized that I know will work. I've been doing this for over 30 years. I know what will work. And it will work, and there are ideas that I didn't think of.
How would you compare it to the other consulting groups? Do you think that we give you more, the same? Would you recommend us to other people?
Yeah, the first time I met them and listened to what their package was, I told them that it was underpriced. I, of course, was a little bit skeptical, like anybody would be, as we are in our profession especially. You know, there's a lot of talk and over-promising and under-delivering. It's the other way around, where we have absolutely under-promising with over-delivering with their service.
You know, that's very nice. And being that you attended Dallas, you know, one of the things that I've learned, there are so many people out there and they're learning about spinal decompression. And Brian, you was in the MRI business, an expert, and we've talked even about my own personal case, and I do appreciate your time. But people don't realize that there is a science to decompression. It's not just about the money, and that's what I respect about you so much. But people that come to the certification course, you know, what I'd like to discuss is what we do at Concierge Coaches with Disc Centers of America is we work on branding. And you who's been in the marketplace, been in medical practitioners, integrated, deal currently with pain people, neuroradiologists, and have MRI centers. By developing that extra, by becoming a client, by getting the branding, becoming part of Disc Centers of America, tell the average doctor out there how that will change their paradigm.
Well, I did have had multiple weight loss clinics over the years, MRI center. Branding is everything. That was the main reason that I reread my contract after going to the Dallas meeting, is because I knew I had to have access to the Disc Centers of America, to be able to use their website, to be able to use the literature that they're putting together. That alone is worth the charge that they're charging me over an 18-month period of time. If I did not get a monthly follow-up from them, I would still feel like I have the dollar's worth of package right here.
So if they came to the Dallas seminar, would it be in the doctor's best interest to sign up, to get the branding, the marketing, the coaching, learning how to do the close? Today we went through the power of the close and understanding that two closes take place with every patient. One takes place when you're with the person that's there face to face, but there's a secondary close that happens. What happens when the patient goes home and talks to their significant other and they say, how much? Do you think that we've worked through that and have all the plans, the materials to help them overcome that secondary close?
Yeah, I at one time had 6 spinal decompression tables. That was about 10 years ago. And I would say maybe 30% of the patients that you sell go home and the sale gets undone by the spouse. And I know beyond a shadow of a doubt, with the material that we have here and the ability for the spouse to be able to look at the website, go on, see all the research and so on, that's going to be reduced to nil.
Would it be fair to say, Dr. Burns, that with what we're doing, that we could assist the average doctor who's dealing with decompression close an additional 2 to 4 cases a month?
Minimally. I will.
Am I underselling and over-delivering
You're,
again?
you're doing the same thing, but that's that speaks to your integrity.
So the question to you out there, as I come to closure, what would 2 to 4 decompression cases be worth to you a month? What would it have to have the branding, the graphic design, developing the relationships that we develop, working with some of the leaders in the industry? This is what we do at Conscious Coaches and Distance America. And if you have questions, you know what? Give me a call. Let's see how we can change your life. Thanks, Brian.
I'm sure glad I did.